Welcome to This Week in Medicine, your filtered medical journal summary. Looking to stay up to date with the latest medical research but short on time? This Week in Medicine has you covered. Our AI-generated podcast provides you with a convenient, on-the-go solution to keep you informed about the most significant developments in the medicine field. Each episode offers a filtered and concentrated summary of key journal articles, allowing you to stay informed without the need to sift through pages of research papers. With This Week in Medicine, listening is faster than reading, and you can consume valuable medical knowledge while commuting, exercising, or during your daily routine.
Hi, This Week in Medicine, we will be discussing. First, we will be discussing articles in New England Journal of Medicine. Measurable Residual Disease Guided Therapy in Newly Diagnosed Myeloma. Background. Measurable residual disease, MRD, is a major prognostic factor in newly diagnosed multiple myeloma. An assessment of an MRD-guided consolidation strategy in patients who are eligible for autologous stem cell transplantation, ASCT, may be useful. Conclusions. Among patients who were MRD negative at 10-5 sensitivity after induction, the percentage with a pre-maintenance MRD negative status at 10-6 sensitivity was not significantly higher with ASCT than with ESA-KRD. Among patients who were MRD positive status at 10-5 sensitivity after induction, the percentage with a pre-maintenance MRD negative status at 10-6 sensitivity was not significantly higher with tandem ASCT than with single ASCT. Next article. A randomized trial of acute normovolemic hemodilution in cardiac surgery. Background. Patients undergoing cardiac surgery often receive red cell transfusions, along with the associated risks and costs. Early intraoperative normovolemic hemodilution, i.e., acute normovolemic hemodilution, ANH, is a blood conservation technique that entails autologous blood collection before initiation of cardiopulmonary bypass and reinfusion of the collected blood after bypass weaning. More data are needed on whether ANH reduces the number of patients receiving allogeneic red cell transfusion. Conclusions. Among adults undergoing cardiac surgery, ANH did not reduce the number of patients receiving allogeneic red cell transfusion. Next, we will be discussing articles from Journal of American Medical Association. Impact of the Mission Act on quality and outcomes of major cardiovascular procedures in veterans. Question. Was the Department of Veterans Affairs, VA, maintaining internal systems and strengthening integrated outside networks, Mission Act implementation, 2019, associated with changes in travel times or outcomes for cardiovascular procedures? Findings. This observational analysis found Mission Act implementation was associated with approximately 30 minutes less travel time for veterans living more than 60 minutes from VA hospitals, but was also associated with worsened rates of major adverse cardiovascular events for this group, meaning the Mission Act was associated with reduced travel time to cardiovascular procedures for veterans living far from VA hospitals, but also associated with higher risk of adverse procedural outcomes. Next, we will be discussing articles from Annals of Internal Medicine. Social Determinants of Health and Long COVID. Background. Social Determinants of Health, STO, contribute to disparities in SARS-CoV-2 infection, but their associations with long COVID are unknown. Objective. To determine associations between STO at the time of SARS-CoV-2 infection and risk for long COVID. Conclusion. Participants with social risk factors at the time of SARS-CoV-2 infection had greater risk for subsequent long COVID than those without. Future studies should determine whether social risk factor interventions mitigate long-term effects of SARS-CoV-2 infection. Next, we will be discussing articles from British Medical Journal. Sex-related differences in efficacy and safety of antithrombotic therapy in patients with coronary artery disease. Objective to evaluate sex-related differences in the treatment effect of antithrombotic therapy in patients with established coronary artery disease. Conclusions. Antithrombotic therapies in patients with established coronary artery disease provided consistent efficacy and safety outcomes in women and men. Next, we will be discussing articles from Lancet. Adjuvant chemotherapy and hormonotherapy versus adjuvant hormonotherapy alone for women aged 70 years and older, with high-risk breast cancer based on the Genomic Grade Index, ASTER 70s, a randomized phase 3 trial. Background. For women aged 70 years or older with estrogen receptor positive HER2 negative invasive breast cancer, hormonotherapy is a standard adjuvant treatment, while the role of chemotherapy is debated. We aimed to assess the effect of adjuvant chemotherapy on overall survival in these older patients with high-risk tumors according to a prognostic genomic signature interpretation. The addition of adjuvant chemotherapy to hormonotherapy conferred no survival benefit in women aged 70 years and above, with a GGI high-risk estrogen receptor positive HER2 negative breast cancer, and was associated with more adverse events, providing important data on the benefit-risk balance of adding adjuvant chemotherapy to adjuvant hormonotherapy in this older age group. Next, we will be discussing articles in the field of hemato-oncology. Here are the articles from JAMA Oncology. First-line therapy for advanced non-clear cell renal cell carcinoma systematic review and meta-analysis. Question: what are the most effective immune therapies for various subtypes of non-clear cell renal cell carcinoma, NCCRCC? Findings. In this systematic review and meta-analysis, including 23 studies encompassing various subtypes of NCCRCC, immune checkpoint inhibitors exhibited a degree of efficacy in the treatment of different subtypes of NCCRCC. The combination of immunotherapy with tyrosine kinase inhibitors appeared to yield superior efficacy compared with the use of single-agent therapies, meaning in the context of NCCRCC, immunotherapy-based approaches may be regarded as a viable first-line treatment option, owing to their enhanced effectiveness. Ongoing research and clinical trials are essential for advancing the management of this heterogeneous and complex group of malignant diseases. Here are the articles from Journal of Clinical Oncology https://ascopubs.org/toc/goc/current. Here are the articles from Journal of Hepatology Carvedilol versus propranolol for the prevention of decompensation and mortality in patients with compensated and decompensated cirrhosis. In compensated cirrhosis, carvedilol reduced the risk of first decompensation compared to propranolol/nadolol. In decompensated cirrhosis, carvedilol reduced the risk of further decompensation compared to propranolol/nadolol. The improved outcomes with carvedilol were likely due to its superior hemodynamic effect. Carvedilol is the preferred non-selective beta blocker for the treatment of portal hypertension. Next, we will be discussing articles in the field of gastroenterology. Here are the articles from Gastroenterology. Mebaverine and the influence of labeling in adolescents with irritable bowel syndrome or functional abdominal pain not otherwise specified. A 2x2 randomized, placebo-controlled trial. Background and aims. Pediatric irritable bowel syndrome and functional abdominal pain not otherwise specified lack effective pharmacologic interventions. The efficacy of mebaverine, an antispasmodic agent, and the effect of labeling within a pediatric cohort were evaluated. Conclusions. Mebaverine was ineffective in treatment of pediatric irritable bowel syndrome and functional abdominal pain not otherwise specified. However, a positive drug label significantly enhanced treatment outcomes compared with a blinded trial label. Here are the articles from Clinical Gastroenterology. Association between the inflammatory potential of diet and constipation among adults in the United States, a cross-sectional study. Objective: to investigate the potential association between dietary inflammatory index, DII, scores and constipation among a sample of adults in the United States. Conclusions. Results of this cross-sectional study suggest that a higher dietary inflammatory index score was associated with increased risk of constipation after adjustment for confounding in a multivariable analysis. Gender and physical activity were found to be an effect modifier of this relationship. Next, we will be discussing articles in the field of cardiology. Here are the articles from Circulation. Non-culprit vulnerable plaques and prognosis in myocardial infarction with versus without ST segment elevation, a Prospect 2 substudy. Background. Clinical guidelines recommend different revascularization strategies for non-culprit lesions in patients with ST segment elevation myocardial infarction, STEMI, versus non-STEMI, NSTEMI. Whether the prevalence of untreated high-risk vulnerable plaques differs in STEMI and NSTEMI and affects their outcomes is unknown. In the Prospect 2 study, the per-patient prevalence of high-risk vulnerable plaques was comparable in STEMI versus NSTEMI, as was the overall long-term incidence of non-culprit lesion-related and all major adverse cardiovascular events. These results support a similar revascularization strategy for non-culprit lesions in patients with STEMI or NSTEMI after culprit lesion management. Here are the articles from Journals of the American College of Cardiology. 10-year outcome of complete or infarct artery-only revascularization in STEMI with multivessel disease, the DENAMI 3 Primalty study. Background. The long-term outcomes of complete revascularization in ST segment elevation myocardial infarction, STEMI, and multivessel disease is unknown. Conclusions. FFR-guided complete revascularization reduced future and repeated events compared with infarct-related artery only after 10 years. The risk was mainly driven by revascularization, with no reduction in myocardial infarctions or death. From JAMA Cardiology. Mode of death in patients with heart failure, with mildly reduced or preserved ejection fraction. The Finiert's HF randomized clinical trial. Question. What is the breakdown of cause-specific mortality in patients with heart failure and mildly reduced ejection fraction, HFmrF, or heart failure with preserved ejection fraction, HFpEF, and is cause-specific mortality modified by finerenone? Findings. In this pre-specified secondary analysis of the finerenone trial to investigate efficacy and safety superior to placebo in patients with heart failure, Finiert's HF, randomized clinical trial of HFmrF/FPFV, roughly one-half of deaths were ascribed to cardiovascular causes, principally sudden death or HF progression. The proportion of all-cause, cardiovascular, and sudden death was higher in those with F less than 50%, and regardless of F, randomization to finerenone did not significantly reduce death or cause-specific death, meaning results suggest that among patients with HFmrF/FPEF, sudden death and death from HF accounted for the majority of cardiovascular deaths. Finerenone did not modify cause-specific mortality. Next we will be discussing articles in the field of endocrinology. Here are the articles from Journal of Clinical Endocrinology and Metabolism. Tumor volume doubling, time of less than 1 year is associated with a higher risk of death, from medullary thyroid cancer. Context. Tumor volume doubling time, TVDT, is emerging as a useful tool in predicting oncologic outcomes. There are limited data on the prognostic role of TVDT in metastatic medullary thyroid cancer, MTC. Objective. The goal of this study was to assess the value of TVDT in predicting disease-specific survival, DSS, in patients with hereditary and sporadic MTC conclusion. Measurements from 3 baseline and 3 most recent scans preceding follow-up visit enable calculation of TVDT and can be used as predictors of mortality from MTC. Here are the articles from Diabetes Care. Associations of AMH in mid-reproductive years with bone mineral density and turnover markers in midlife. Context. The concentration of circulating anti-Mullerian hormone, AMH, predicts short-term, 3 to 5 years, bone loss around menopause. Whether AMH during mid-reproductive years predicts bone health over a decade later is unknown. Objective. To study the association of AMH levels in mid-reproductive years with bone density and turnover biomarkers, measured after 14 years of follow-up. Conclusion. Lower AMH during mid-reproductive years is associated with lower BMD and higher bone turnover 14 years later. Ovarian reserve during mid-reproductive years may be a valuable predictor of long-term bone health. Next, we will be discussing articles in the field of neurology. Here are the articles from neurology. Risk of ventricular arrhythmia and sudden cardiac arrest among older patients using lamotrigine for epilepsy. Background and objectives. Lamotrigine, an anti-seizure medication, blocks the activation of voltage-gated sodium channels and reduces the excitability of cardiomyocytes in vitro. Based on concerns for QT prolongation and case reports of arrhythmias among lamotrigine users, the U.S. Food and Drug Administration placed a safety warning on lamotrigine's label in 2020. However, limited evidence exists on the cardiac risk of lamotrigine in patients with epilepsy. This study assessed whether lamotrigine users with epilepsy had an increased risk of ventricular arrhythmia and sudden cardiac arrest, VA/SCA, compared with users of levetiracetam. Discussion. In older adults with epilepsy, lamotrigine was not associated with an increased risk of VA/SCA compared with levetiracetam, including among those with underlying heart disease. Our findings do not support the reported cardiac risks associated with lamotrigine or the recent changes to its safety label. Next, we will be discussing articles in the field of pulmonary and critical care. Here are the articles from CHEST. Trajectories of interferon gamma release assay results over 2 years in independent cohorts from China, South Africa, Tanzania, and the United States. Background. There is an ongoing debate about whether clearance of Mycobacterium tuberculosis infection occurs and at what magnitude. Recent studies quantifying uncertainty zones of interferon gamma release assays, EGRAs, provide a more stringent estimate of reversion. Research question. When accounting for uncertainty zones through stringent cutoffs, what are the trajectories of EGRA's results over 2 years of testing? Interpretation. These results suggest high annual rates of EGRA reversion. Even with the use of uncertainty zones, reversion rates decreased over time from exposure and at older ages. Here are the articles from the American Journal of Respiratory and Critical Care Medicine. Iloprost for the treatment of severe septic shock with persistent hypoperfusion, a double-blind, randomized controlled trial. Rationale. Preclinical and preliminary clinical data suggest that iloprost may improve tissue perfusion in septic shock. However, its effect on organ failure remains unclear. Objectives. To investigate whether iloprost provides organ protection in septic shock with hypoperfusion. Conclusions. Among patients with septic shock and persistent hypoperfusion, iloprost did not reduce the severity of organ failure. Next, we will be discussing articles in the field of nephrology. Here are the articles from Clinical Journal of American Society of Nephrology. Decision readiness and determinants of KRT among veterans with advanced CKD. Key points. Most prevalent patients with advanced CKD are unable to select any KRT modality for themselves, highlighting concerns with advanced CKD clinical care. Prior receipt of KRT-directed education is associated with greater KRT decision readiness and home dialysis selection. Objective disease knowledge is among the strongest and most modifiable predictors of the KRT decision readiness, its quality, and home dialysis choice. Here are the articles from Kidney International Reports. Low-energy diets for obesity and CKD. Slow CKD randomized feasibility study introduction. Low-energy diets, LEDs, may slow disease progression. However, their effects are under-researched in chronic kidney disease, CKD. This study evaluated the safety and feasibility of an LED weight management program in adults with obesity and CKD. Conclusion. LEDs under professional guidance are safe and feasible for weight loss in adults with obesity and CKD kidney disease, improving global outcomes stages G1 to GEB. A definitive RCT to assess their effects on clinical outcomes and CKD progression is warranted.
Thank you for listening to This Week in Medicine, your filtered medical journal summary. Have a great week ahead, stay blessed and be humane.